Okay, this is Trach Care. First, I would introduce myself and identify the patient using 2 forms of identification. Then I would explain the procedure. I'm going to replace your inner cannula and clean around the opening. And I would raise the bed. Oh. And I would provide privacy. Sorry. Gather all the supplies. Should be.
Did you say allergies? Ask them if they're allergic to anything. Do we have to?
That wasn't even on the sheet.
Do we do? Okay.
I don't know. I can ask her.
I'm probably going to say it on every single one.
That's fine. Have the kit, the gloves, and the sterile saline. Where's the face shield? You do hand hygiene, and then you would put on the face shield, which I'm not going to do. It's really hard. Okay. Then I would open the package, and I would put on clean gloves, and I would remove the oxygen source, and I would stabilize the outer cannula with my non-dominant hand. So, and then my dominant hand, I would remove the inner cannula, and I would dispose of it if I had another sterile one in here. Okay. Then I would remove the old gauze and dispose. Discard my gloves and then put on sterile gloves. This is awful.
Yeah, I need to powder those babies up. She's probably going to give us a pair, though. Don't you think? No.
I think you guys bring your own. Yeah. We did it in catheter. Okay. Then I would pick up the new cannula, like if it was a new one. I would pick it up with my dominant hand and securing the faceplate with my non-dominant hand. What's wrong with this thing? Whatever. I can't touch. Hold on. Is that right? Okay. And lock it into place. Then I would apply the clean dressing. So I would open the kit. I thought the kit was already open. No.
You did already open it.
Yeah, because you put saline in, right?
No, not yet.
Oh.
I should have done it first, but it says it on this, so I need to change that. Okay, before, right when I open the kit, I would pour the saline. But should I dispose of this stuff first?
I would if you're not going to
Yeah,
use it.
because your hand is not sterile anymore, so you're reaching around. So I would take the stuff out
Before. Okay, and I don't need this.
So before you put on the sterile gloves, you're going to just get rid of all that and put the saline in?
No, you'll have your sterile gloves on, but before you touch anything over there.
But you can't touch that saline bottle with sterile
before
gloves.
you put
Yeah,
your gloves on.
so I would do it before, I would just do the saline. I wouldn't touch anything in here yet. And I would put
Okay.
that on, then I would dispose of anything. So, what was I doing?
Well, you would do this without your gloves on. Then you would put your gloves on. Then you would right away take the stuff out of here.
Okay.
Because then your hand's going to be non-sterile when you touch them. You know what I mean?
Okay.
I don't know.
Okay, I mean,
Just trying to-
we have to go through it, we'd have to go through it again because I'm confused, but, okay. So,
You've done good.
dip the gauze. This would be disposed of. Oh, remember she was saying that we could like put one over here to be the dry, and then put the saline over the other ones. Because this isn't sterile, a sterile procedure.
Right.
Wait, hold on. I thought you had sterile gloves on.
It is.
But it's not sterile anymore?
After I put that in, I don't have to worry about being sterile.
How are you going to move around? Oh, we'll just have those things already in those holes before we pour the saline? Because you can't move this stuff in there and then touch the saline to pour it onto them. Or, you know what I mean? Or do you just dip it?
You should be able to use your right hand still to touch. Well, it doesn't matter. Nothing's sterile anymore.
It's not sterile anymore, so does it matter?
Okay.
Okay, so then I would clean under. So, take another one. Should I clean top first?
I think you can just do the whole top, the whole bottom, and then use the pipe, the Q-tip to get underneath.
Yeah. Underneath. Then I would dry it. And then I will apply the new Trach dressing. It's tricky.
We just use one, or do we use two for that?
That's just one.
We just wrap it around like, okay.
Use the split one.
The V.
Yeah.
Oh, there's a split one?
That's it. It's a split one. It's already in there. Oh, what is that?
That's the one that was
that's
fine.
the
'cause
old
that's,
one.
But that's the
Someone
one
else's?
that-
Okay. And then I will take the collar, the new collar, get another person to assist in holding the faceplate in place while I would remove this collar and put the new collar on. Which I don't really know how we're going to do that yet, but we'll have to ask. And then we check the fit of the Trach collar. You should be able to put one finger in between the collar and the neck. And we apply the oxygen source. Dispose of supplies, gloves, and then take off the mask. Reassess the patient's respiratory status and place patient in position of comfort. Put the bed down and side railed up. Cut.